Now this, to your health. Nearly 13% of adults in Houston live with diabetes, and for some neighborhoods, that number's even higher, up to 24%. In our latest To Your Health segment, we're welcoming back Dr. David Pearce, Chief Medical Officer for the City of Houston, to talk about it. Doctor, good morning again. How are you?
Good morning. Thanks for having me back.
Doctor, first off, can you tell our viewers a little bit about the difference between type 1 and type 2 diabetes? I understand they have different causes, and type 2 is more preventable?
Yeah, absolutely. So type 1 diabetes is where the cells in your pancreas that produce insulin stop producing it. And that can be from a variety of causes, but they're almost all genetics. There's not a whole lot that an individual can do to prevent type 1 diabetes. And again, that usually follows family lines because of a genetic link there. Type 2 diabetes, on the other hand, we are all susceptible to developing type 2 diabetes because this is where your body becomes tolerant or resistant to the insulin that your body produces. And that has a lot to do with our diet. So big differences there.
Anytime I hear diet, we hear, oh, this is preventable. We can do something about it. So how do we lower our risk individually?
Yeah, so one thing that I find that helps people sort of understand is that you develop what's called insulin resistance. And my endocrinology colleagues will kind of roll their eyes a little at this, but I find that patients understand that, you know, if you have one beer or one drink, you feel a certain way. And then after a while, you need 2 beers or 2 drinks to feel that way. And then later on, you need 3 beers or 3 drinks to feel that way. Well, it's sort of the same with your body and insulin. But it's because if we have something which is really sugary, like a sugary soft drink or a candy bar, we get a spike in insulin because there's so much sugar that your body takes in a very short period of time. And over a lifetime of doing that, your cells become resistant to the insulin. So your pancreas is producing it, but your cells aren't responding to it. So that's type 2 diabetes. And that's where we have control by controlling your diet and eating fewer foods that will spike your insulin and more foods that will gradually use the insulin. That way you don't bring on type 2 diabetes. So
let's say, doctor, I don't know, I'm almost 50. I've been eating terribly my whole life. Can I turn this around? Is it ever too late?
Great question. It is never too late to change your diet and make it healthier and have a positive impact on your body's ability to use the insulin it has. The other thing that's a great help is to exercise. So exercise also has an impact on your body's metabolism, a very beneficial one. So by eliminating or greatly reducing, those sugary soft drinks, the candy bars, the breakfast cereals that got lots of sugar on them, by reducing those and exercising, you can actually reverse the process and allow your cells to use insulin more properly.
Doctor, let's get to the good part for people who need this help and they want some treatment. The city has 4 free centers in Houston. Where are those and what can they get? What kind of help is available?
Yeah, so we've got a number of centers across the city. It's part of our Dawn project, and they are at the Acres Homes Multi-Service Center at 6719 West Montgomery. Also the A-Leaf Multi-Service Center at 11903 Bel Air. Denver Harbor Multi-Service Center at 6401 Market Street. And finally, the Third Ward Multi-Service Center at 3611 Ennis Street. And they have, again, it's the Dawn, which is the Diabetes Awareness and Wellness Network.
And doctor, before you go, I just want to go back to that initial statistic I mentioned. Roughly 13% of adults in Houston have diabetes of some kind, and the number can be higher in certain neighborhoods. So if type 2 isn't genetic, what do these neighborhoods need? Is it these services? Is it more education? How can we help reverse those numbers in some of these places where it's higher?
So, we know in certain neighborhoods we have what we call the food deserts. And this is where healthy food is hard to find. And so what is easy to find in these neighborhoods, unfortunately, are the highly processed, easy foods that you can get from those little shops, like the gas station or these little marts that don't have the fruits and vegetables and complex carbohydrates that you need. So one of the things that we as a community need to do is start focusing on getting rid of our food deserts and giving those folks in those neighborhoods easy access to healthy food.
Yeah, more grocery stores, community gardens, whatever it takes. Dr. Pearce, Chief Medical Officer for the City of Houston. I'm really enjoying our weekly talks. Thanks for spending this time with us once again.
Okay, thank you.
And if, folks, you want to find that information we mentioned about the 4 free centers, you can catch To Your Health Monday exclusively on our live stream and search click2houston.com/scene at 7. And